Ever asked why your newborn's skin turned yellow all of a sudden? This is often a result of a condition known as newborn jaundice. It's fairly common and usually nothing to worry about. Jaundice in newborns is caused by a surplus of bilirubin in the blood. Bilirubin, a byproduct of old red blood cells, can cause a yellowish tint to the skin and eyes. So this yellowish hue on your newborn, it's called jaundice. But what exactly does that mean? Unmasking jaundice isn't a mystery when you know what to look for. At the heart of newborn jaundice is a yellowing effect, painting the skin and the whites of the eyes with a golden hue. It usually starts on the face and spreads downward. But jaundice is not just a painter, it's a bit of a trickster too. It might make your baby sleepier than usual, or show less interest in feeding. It's like your little one is auditioning for a role in Sleeping Beauty, right? Now, these symptoms are quite common and not typically a cause for alarm, but they do warrant attention. With jaundice, it's always better to be the observant parent than the worrywart. Remember, knowledge is your ally in this journey. Being aware of these symptoms is the first step in spotting jaundice in your newborn. So, your newborn has jaundice. What's next? Well, let's dive into the primary treatment for newborn jaundice: phototherapy. You may be wondering, phototherapy? Like taking photographs? Not quite. Phototherapy is a special light treatment that helps break down the excess bilirubin in your baby's body. Think of it as your little one having a spa day, basking under a warm light. But instead of getting a tan, they're getting healthier. Now let's talk about phototherapy blankets. These are not your average swaddles. These blankets emit light that penetrates your baby's skin, helping to break down that pesky bilirubin. It's like a superhero cape, fighting jaundice one photon at a time. But there's more you can do at home. The key is frequent feeding. The more your baby eats, the more they poop and the quicker they flush out bilirubin. It's a win-win situation. With these treatments and remedies, you're well equipped to help your newborn through jaundice. But what if the yellow doesn't fade? It's time to watch for these signs. Worsening jaundice might present itself as an increased lethargy in your little one, or perhaps their appetite isn't what it used to be. These are signs that should not be ignored. It's crucial to seek medical attention if you notice these changes. Remember, you're not alone in this. Reach out to your healthcare provider if you're concerned. Together, we can ensure your newborn is healthy and happy.
Dive into the world of parenting with us. Click that circular icon, subscribe, and stay in the loop. Your support fuels our community. Await the next Newborn Smiles video with anticipation.